All right, let's get ready, because today we're going to be diving deep into infection control, straight out of a nurse assistant training module.
Nice.
It's all about medical and surgical asepsis.
Yeah.
How the pros, keep those nasty infections away.
Absolutely. And it's really fascinating stuff. Even if you're not in healthcare, this is relevant to everyone.
Right. I mean, who wants to get sick?
Exactly.
So this module jumps right into the 4 main types of infectious agents.
Yeah.
We got bacteria, viruses, fungi, and protozoa.
It's amazing, how much we coexist with these microscopic entities every day.
Right?
And they each have their own unique way of causing trouble.
Yeah.
Like, take streptococcus.
Yeah, okay.
That bacteria that can cause everything from a simple sore throat to full-blown pneumonia.
Yeah. And we can't forget about E. coli.
Oh, yeah.
Notorious for causing those painful UTIs. And then there's tuberculosis, which attacks the lungs.
Yeah.
Pretty serious stuff.
It really is.
And then you got viruses like HIV, hepatitis, influenza,
Yep.
and even shingles.
They're so tiny but can really pack a punch.
Okay, now on to fungi.
Okay.
This is where it gets personal for me.
Yeah.
I've definitely battled athlete's foot a time or two.
Mm-hmm.
Apparently, it's caused by a fungus called Taenia pedis.
Right.
Who comes up with these names?
I know. And Candida albicans.
Yeah?
Those yeast infections, so uncomfortable.
So bacteria, viruses, fungi, and the last one, protozoa.
Yeah.
What exactly are those?
Protozoa are single-celled organisms,
Yeah.
like tiny little independent creatures living their best life.
Interesting.
But some of them can cause some real havoc, like the one that causes malaria.
Okay.
And it's fascinating how they spread,
Yeah.
often through mosquitoes.
Mosquitoes, the ultimate party crashers.
That's about right.
But back to these infectious agents, there's this whole thing about antibiotic resistance,
Yeah.
which sounds kind of terrifying.
It is a huge concern.
Yeah.
Essentially, some bacteria have evolved to survive our antibiotic attacks.
Oh, what?
Yeah, like they've developed shields against our weapons,
Oh, no.
making infections much harder to treat.
So we're talking superbugs like MRSA and VRE.
Exactly.
Like something out of a science fiction movie, but it's actually happening.
It's a real problem, and it's largely due to the overuse and misuse of antibiotics.
Yeah.
We really have to be more careful
Wow.
about how we use these powerful drugs.
So the module talks about the 5 things that microbes need to thrive.
Right.
Food, moisture, oxygen, warmth, and darkness.
Mm-hmm.
It's like they have their own 5-star hotel in our bodies.
And what's really fascinating is if you understand what they need to survive,
Yeah.
you can start to figure out how to disrupt their little party.
I like that.
Like, for instance, moisture is a big one.
Okay.
So as a future nurse assistant, you'll learn how crucial it is to keep surfaces dry,
Right.
especially in places like bathrooms.
Makes sense.
Or where there might be bodily fluids.
Oh, yeah.
It's a simple step, but can make a huge difference.
So you're saying by understanding the enemy, we can strategize better ways to fight them.
Exactly.
I like it. Let's talk about the chain of infection.
Okay.
The module describes it as a 6-part process.
It's like a detective story, trying to track the culprit from start to finish.
Okay.
It starts with the causative agent, the germ itself.
So that's our bad guy.
Right.
But every bad guy needs a hideout, right?
Exactly.
That's where the reservoir comes in.
The reservoir could be a person, an animal, or even the environment.
Okay.
Any place where the germ can hang out and multiply.
But eventually, our villain needs to make a grand escape.
Right.
That's the portal of exit,
Yeah.
how the germ leaves the hiding spot.
Think of it as the escape route.
Okay.
Could be through bodily fluids, a cough, a sneeze. Those little droplets can travel farther than you think.
So our germ is on the run.
Mm-hmm.
Now we need a getaway car.
Okay.
That's where the mode of transmission comes in.
The mode of transmission describes how the germ travels. It could be direct contact, like touching someone who's sick, or indirect contact,
Okay.
like touching a doorknob that an infected person has touched.
Right. And of course, there's airborne transmission,
Absolutely.
especially relevant with things like the flu.
Yeah, and then there's the portal of entry, basically how the germ gets into a new host,
Okay.
like finding a secret passage into a castle. I know, right? It could be a cut in the skin, our respiratory system.
So many ways to sneak in.
I know.
And finally, we have the susceptible host.
Right.
That's the person who ends up getting infected.
Exactly.
So the chain of infection is like a complex game of tag.
Yes.
With these microscopic players passing the infection from one to another.
And understanding this chain is crucial for you as a future nurse assistant.
Right.
By understanding how infections spread,
Yeah.
you can learn how to interrupt that chain and prevent the spread.
It's like being a disease detective.
You got it.
But we're not defenseless.
No, we're not.
Our bodies have ways to fight back.
We have an amazing defense system that's constantly working to keep us healthy.
The module mentions 4 lines of defense. Normal flora,
Yes.
intact skin, mucous membranes, and the immune system.
Our body's elite special forces unit.
It's like our bodies have built-in security guards.
The normal flora are the good bacteria that live on and in us.
Okay.
Like the friendly tenants who help keep the bad guys out.
Yeah.
Then there's our skin, which acts as a physical barrier.
Right.
And the mucous membranes in our nose, mouth, and other openings trap those invaders before they can get too far.
And then there's the immune system, our body's elite special forces unit.
An intricate network of cells and processes that work tirelessly to identify and destroy those unwanted guests.
But sometimes those sneaky invaders manage to slip through the cracks.
Unfortunately, yes.
And that's when we get an infection. So how do we know if something's wrong?
Well, that's where knowing the signs and symptoms of infection comes in. Things like loss of appetite, pain, diarrhea, fatigue, fever, nausea, redness, swelling, the list goes on.
It's a lot to keep track of.
It is.
But it sounds like being observant and knowing what to look for is key.
Absolutely.
Especially as a nurse assistant, working with patients.
Early detection is crucial.
Right.
The sooner you recognize the signs of infection, the sooner you can take steps to treat it and prevent it from spreading.
So let's say you're a nurse assistant on the front lines, facing these potential threats every day.
Yeah.
What's your game plan?
That's where medical and surgical asepsis come in.
Okay, so those are our weapons.
They're the 2 main strategies that healthcare professionals use to combat infection.
Okay, tell me more.
Medical asepsis is all about reducing the number of microorganisms.
Okay.
Think hand washing, using gloves, disinfecting surfaces, like basic hygiene on steroids.
So medical asepsis is like minimizing the risk.
Yeah.
What about surgical asepsis?
Surgical asepsis is the next level up.
Okay.
It aims to completely eliminate microorganisms from an area or object.
Wow.
We're talking sterilized instruments, sterile gloves, and gowns.
Yeah.
A carefully controlled environment to prevent any contamination.
It's like creating a germ-free bubble.
Exactly.
Wow.
And this is especially important during surgeries, invasive procedures, or any situation where introducing even a tiny germ could have serious consequences.
And all of this is guided by recommendations from the CDC.
That's right.
And enforced by OSHA.
That's right.
Okay.
The CDC provides the scientific expertise and the guidelines for infection control, while OSHA makes sure those guidelines are followed in workplaces.
Makes sense.
To keep everyone safe.
So we've got our strategies, but what about the ground rules?
Okay.
The module emphasizes standard precautions, which apply to all patients, regardless of their diagnosis.
Standard precautions are like the universal code of conduct for healthcare professionals. They're the baseline for preventing the spread of infection in any setting.
So it's like assuming everyone's potentially contagious.
Exactly.
Even if they don't seem sick.
Because you never know what you're dealing with.
Sure.
And when it comes to infection control, it's always better to err on the side of caution.
So what are some of the key practices under standard precautions?
Okay.
Seems like hand washing is a big one.
Hand washing is the cornerstone of infection control.
Yeah.
It's the single most effective way to prevent the spread of germs.
Okay.
And it's not just a quick rinse.
Right.
We're talking a full 20 seconds of scrubbing with soap and water.
20 seconds.
20 seconds.
Wow, it's longer than I thought.
Getting under those fingernails.
Yeah.
Where those little microbes love to hide.
It's like a mini hand spa treatment.
It might seem simple.
Yeah.
But it's incredibly effective.
Okay.
And then there's PPE.
PPE?
Okay.
Our personal protective equipment?
It's like our superhero suit.
Exactly.
Protecting us from those invisible villains. We've got gloves to protect our hands, gowns to shield our clothes, masks to filter the air we breathe, and goggles or face shields to protect our eyes.
Right.
Each piece of PPE serves a specific purpose.
Okay.
And knowing when and how to use it correctly is essential.
So it's not just about wearing the gear, but wearing it the right way.
Absolutely.
At the right time. And of course, there's safe sharks disposal.
Yes.
That one seems pretty straightforward, right?
It is straightforward.
Hey.
But it's also crucial to follow the guidelines meticulously.
Okay.
Never recap needles. Always dispose of sharps in designated containers and handle them with extra care.
Makes sense.
A single accidental needle stick can have serious consequences.
Okay, so standard precautions are our baseline defense.
Right.
But what happens when we know there's a specific infection we need to contain?
That's where transmission-based precautions come in.
Okay.
They're like specialized units deployed to combat specific threats. We've got 3 main types: airborne, droplet, and contact precautions.
So let's break those down.
Okay.
What are airborne precautions all about?
Airborne precautions are for infections that can spread through the air over long distances, like tuberculosis and measles.
Right.
These tiny infectious particles can linger in the air, so we need to take extra steps to prevent them from reaching others.
So if someone has measles, they're not just going to get a regular hospital room, right?
Right. They'll be placed in a special isolation room with negative air pressure.
Wow. So it's like their own personal air filtration system.
It's designed to prevent those tiny infectious particles from escaping into the general air circulation.
That's impressive. What about droplet precautions?
Droplet precautions are for infections that spread through larger respiratory droplets, like the flu.
Right.
These droplets can travel up to 6 feet when someone coughs or sneezes.
So masks and keeping a safe distance are key here, right?
Absolutely. A regular surgical mask can effectively block those larger droplets, and maintaining that 6-foot distance creates a safety zone, reducing the chance of those droplets reaching someone else.
All right, last but not least, we got contact precautions.
Okay.
What are those all about?
Contact precautions are for infections that spread through direct or indirect contact, like MRSA and VRE.
Right.
These infections can linger on surfaces, so we need to be extra careful to prevent them from spreading.
So gloves and gowns are essential here, right?
Absolutely.
Yeah.
Wearing gloves whenever you're in contact with the patient or their environment prevents you from picking up those germs.
Okay.
And wearing a gown prevents your clothes from becoming contaminated.
So it's like creating a barrier between yourself and the infection.
Exactly.
But all these precautions, while necessary, can also have a psychological impact on patients.
That's a really important point. Isolation can be incredibly lonely and stressful for patients.
Right.
It's vital to remember that they're not just dealing with a physical illness, but also with the emotional and social effects of being isolated.
So as a nurse assistant, you're not just treating the physical symptoms.
Exactly.
They're treating the emotional ones, too.
It's about providing holistic care.
I like that.
Taking the time to explain the reasons for isolation, making sure patients have ways to connect with loved ones, and simply offering a kind word or a listening ear
makes sense.
Can make a huge difference.
It's about treating the whole person, not just the illness.
Exactly.
Well, we've covered a lot of ground in this first part of our deep dive into infection control. We've explored the different types of infections, how they spread, how our bodies fight back, and the precautions healthcare professionals take to keep everyone safe.
We've also touched on the importance of understanding the psychological impact of infection control and providing holistic care to patients.
So much great information packed into this nurse assistant training module.
There is.
But we're not done yet.
No.
Stay tuned for part 2,
where
we'll explore how all this knowledge translates into real-world scenarios. And we'll see how infection control plays out on the front lines of healthcare.
Sounds good.
Until then, stay curious, stay informed, and as always,
wash your hands.
Wash your hands.
Yes.
Welcome back to our deep dive into the world of infection control.
Yeah.
We've covered a lot of ground already.
Yeah.
From those tiny infectious agents to the different ways they spread and the amazing defenses our bodies have.
It's incredible, really.
It is.
We also explored the different levels of protection healthcare professionals use, from basic hygiene practices to those specialized precautions for specific infections.
It's like learning a whole new language of safety and prevention.
It really.
But now I'm curious to see how all this knowledge translates into those real-life situations.
All right.
So imagine you're a newly trained nurse assistant walking onto a busy hospital floor for the first time.
Wow.
What's going through your mind?
Honestly, I think I'd be feeling a mix of excitement and nerves.
Yeah.
Excited to put my skills into practice,
right?
But also a bit apprehensive about facing those potential infection risks head on.
That makes sense.
Yeah.
It's one thing to learn about infection control in a classroom,
right?
But quite another to actually apply it in a dynamic,
absolutely
high-pressure environment like a hospital.
For sure.
So how would you use what you've learned to navigate that situation and keep both yourself and your patient safe?
Well, the first thing I would do is mentally review those standard precautions. For like my safety mantra, hand hygiene would be top of mind, of course. I'm washing my hands religiously. Before and after every patient interaction, after touching any equipment or surfaces, and anytime I even think about touching my face.
It's like developing a sixth sense for potential contamination.
Yeah, almost like a superpower.
Right. Yeah. And PPE would be your trusty sidekick.
Absolutely.
I'd make sure you're using the right type of protection for each situation, whether it's gloves, a gown, a mask, or eye protection.
Exactly.
And I'd be extra careful about putting it on and taking it off correctly to avoid any accidental contamination.
Yes, for sure.
So it's not just about wearing the gear.
No.
It's about wearing it with purpose and precision.
I like that, wearing it with purpose.
And you'd be hyper aware of your surroundings.
Absolutely.
Making sure to keep your work area clean and disinfected.
Right.
Properly disposing of any contaminated materials and following all of those protocols for handling linens and waste.
Absolutely. Following the rules.
It's almost like transforming into a meticulous cleaning ninja.
That's a great image.
Striking down those invisible enemies with every wipe and spray.
Love it.
And communication would be key.
Oh, absolutely. Communication is so important.
You be sure to communicate with your colleagues about any potential infection risks.
Yeah.
Follow isolation guidelines carefully and advocate for your patient's well-being.
Absolutely.
By explaining the precautions being taken and answering any questions they might have.
It's all about teamwork, really.
So it's a team effort.
It is.
Everyone on the healthcare team has a role to play in infection control.
From the doctors and nurses to the cleaning staff and even the patients themselves.
We all have a responsibility to work together
to
create a safe environment.
Absolutely.
Now, let's zoom out a bit and talk about the bigger picture.
All right.
We've touched on antibiotic resistance, which seems to be a growing threat in healthcare settings.
It really is. How does that impact infection control practices? Antibiotic resistance is a huge challenge. It is. It makes everything more complicated. Yeah. Because it really limits our options for treatment. Right. Infections that were once easily treatable with antibiotics can become much more difficult to manage. Right. And even life-threatening.
It's like those superbugs are constantly evolving.
They are. It's amazing.
Finding ways to outsmart our defenses.
It's a constant arms race.
Wow.
That's why it's so crucial to use antibiotics responsibly, only when they're truly necessary and to complete the full course of treatment as prescribed.
So what can we do to support that responsible antibiotic use?
Well, education is key.
Okay.
We need to educate both healthcare professionals and the general public about the importance of responsible antibiotic use.
So it's not just about what doctors prescribe. It's also about patients understanding why it's important to follow those instructions and finish the entire course of antibiotics.
Yes.
Even if they start feeling better.
Even if they start feeling better, that's so important.
And we also need to encourage research and development
Absolutely.
Of new antibiotics and alternative therapies to stay ahead of those evolving superbugs.
They gotta stay ahead of
It's like we need a whole arsenal of weapons to fight this battle.
We do.
Now, let's shift gears for a moment.
Okay.
And talk about those of us who aren't healthcare professionals.
Right.
What can we do in our everyday lives to support those infection control efforts and protect ourselves and our communities?
That's a great question.
Yeah.
We all have a role to play, even outside of healthcare settings.
Okay.
First and foremost, practice good hand hygiene.
All right.
Wash your hands frequently with soap and water.
All right.
Or use an alcohol-based hand sanitizer.
Right.
When soap and water aren't available.
So important.
It is. It can't be emphasized enough.
Wash those hands.
Wash those hands.
It's true. It's such a simple but effective way to prevent the spread of germs.
It's really the easiest thing you can do.
And if you're feeling sick, stay home.
Stay home.
Avoid spreading those germs to others.
Exactly.
It might seem inconvenient.
It might.
But it's a small sacrifice that can make a big difference in protecting those around you.
It's like a little act of heroism.
It is.
Staying home and preventing a potential outbreak.
And cover your coughs and sneezes with a tissue or your elbow, not your hand.
Right.
It might seem like a small detail,
It does.
But it can significantly reduce.
It really can.
The spread of those respiratory droplets.
I saw something online recently. It was called the vampire sneeze. Have you heard of that?
Oh, yeah, the vampire sneeze.
Where you cover your sneezes with your hands and then immediately touch something.
Right, like a doorknob or something.
Like a doorknob, exactly.
It's like a stealthy way to spread those germs far and wide.
A stealthy way? That's a good way to put it.
But in all seriousness, it's a good reminder.
It is.
To be mindful of our actions.
Yes.
Even those seemingly small habits.
Right.
That can contribute to the spread of germs.
Absolutely.
And speaking of prevention.
Okay.
Don't forget about vaccinations.
The vaccinations are so important.
They're one of the most powerful tools we have.
They are.
To prevent the spread of infectious diseases.
Absolutely.
It's like giving our immune system a cheat sheet.
That's a great way to put it.
So they know how to fight those invaders before they even arrive.
Before they even show up.
And by getting vaccinated,
yes,
you're not only protecting yourself,
right,
but also those around you.
Exactly.
Who might be more vulnerable to infection.
Especially those who are more vulnerable.
It's like creating a shield of protection for the entire community.
A shield of protection. I love that.
And another thing we can all do is be aware of our surroundings.
Right.
If you're in a healthcare setting, pay attention to those posted guidelines for infection control.
Yes. Be aware.
Wash your hands when you enter and leave.
Always.
Wear a mask if requested.
If requested.
And don't be afraid to ask questions.
Please ask questions.
If you're unsure about anything.
It's better to be safe than sorry.
Exactly. It's like being a proactive participant.
Yes.
In your own health and safety.
Right. And finally, don't underestimate the power of advocacy.
Advocacy. Okay.
To speak up for strong infection control practices in your community. Support policies that promote responsible antibiotic use and encourage research and development of new infection-fighting strategies.
It's about creating a culture of prevention.
It is.
Where infection control is everyone's priority.
Absolutely, everyone's priority.
It's about recognizing that we're all in this together.
We are.
Our health and well-being depend on it.
Well said.
This has been a truly fascinating exploration of the world of infection control. We've covered so much ground.
I know. So much.
From the microscopic details of how infections spread to the real-world implications of antibiotic resistance and the importance of individual and collective action in preventing the spread of disease.
It's been a journey.
And we've also highlighted the human side of infection control, emphasizing the importance of communication, compassion, and understanding the psychological impact of isolation.
That's so important.
On patients.
It really is.
So many important takeaways.
There are.
But we're not quite done yet.
Not quite done.
Stay tuned for our final segment, where we'll wrap up this deep dive with some final thoughts and reflections on what we've learned and how we can apply this knowledge to create a safer and healthier world.
Sounds good.
We'll also explore some emerging trends in infection control.
All right.
And discuss the importance of staying informed and engaged in this ever-evolving field.
I'm excited.
Until then, stay curious,
informed,
and as always,
wash those hands.
Wash those hands. Welcome back to the final part of our deep dive into infection control. It's been quite a journey.
It really has. We've gone from the basics of bacteria and viruses all the way to the complexities of antibiotic resistance and the psychological impact of isolation.
And we've seen how infection control, it isn't just about following rules. It's about understanding the science behind those rules.
Absolutely.
And using that knowledge to make informed decisions.
Yeah, it's like we've all become little infection control detectives.
Exactly. And I think that's a key takeaway for our listeners.
It is.
Whether you're a healthcare professional or just someone who wants to stay healthy. Understanding how infections spread and how to prevent them empowers you to take control of your own health and the health of those around you. It's like we've all gained a secret weapon in the fight against germs.
I love that.
But I have to admit, sometimes it can feel a little overwhelming.
I understand that.
All these precautions and protocols.
You can...
Is it really possible to keep up with it all?
Yeah, it can definitely seem like a lot to remember.
Yeah.
But here's the thing. You don't have to be perfect.
Really?
Even small changes in our habits can make a big difference.
So you're saying it's not about being a germ-fighting superhero. It's about making those small, consistent efforts that add up over time.
Exactly. Think of it like this. Every time you wash your hands thoroughly, you're breaking a potential chain of infection.
Right.
Every time you get vaccinated, you're not only protecting yourself, but also contributing to herd immunity, making it harder for diseases to spread.
So it's like we're all part of this giant interconnected web of health.
I love that.
And our individual actions have ripple effects that extend far beyond ourselves.
I love that analogy. And as we face new challenges like antibiotic resistance and the emergence of new infectious diseases, it's more important than ever to adopt this collective mindset. We need to view infection control not as a burden, but as a shared responsibility.
It's about recognizing that our health is intertwined.
Exactly.
And that by working together, we can create a safer and healthier world for everyone.
Absolutely. And that brings me to a final thought I want to leave our listeners with.
Great.
What if we shifted our perspective and started viewing infection control not as a defensive measure, but as an act of care?
An act of care. Tell me more.
Think about it. When we wash our hands, wear a mask, or get vaccinated, we're not just protecting ourselves. We're showing care for our families, our communities, and even strangers we might never meet.
It's like those random acts of kindness.
Exactly.
But for public health?
I love that. And that simple shift in perspective can be incredibly empowering. It transforms infection control from a chore into a meaningful act of compassion.
Wow. That's a powerful way to think about it.
It is.
So as we wrap up this deep dive, what's the one message you'd like our listeners to take away?
That infection control is more than just rules and protocols. It's about knowledge, awareness, and action. It's about understanding that our health is interconnected and that we all have a role to play in protecting ourselves and each other.
And most importantly, it's about approaching infection control with a sense of care and compassion.
Absolutely.
Recognizing that our actions can have a positive impact on the world around us.
Beautifully said.
Well, that brings us to the end of our deep dive into the world of infection control.
It does.
We've covered a lot of ground.
We have.
From the tiniest microbes to the biggest public health challenges. We've explored the science, the strategies, and the human side of this fascinating field.
And I hope our listeners have come away with a newfound appreciation for the importance of infection control.
I know I have.
And the power we all have to make a difference.
So until next time, stay curious, stay informed, and as always,
wash your hands.
Wash your hands.